Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's docket, we're going to be talking about buttocks enhancements. Are there any good options out there? We're going to go over them. Then there's a story about a surgeon who is allegedly operating drunk. Is it true? We're going to talk about it. And then finally, Sarah's going to tell us if magnesium supplements are good for your workout, and it's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you so much for tuning in. We really do appreciate it. Please smash that like and subscribe button. It really does help us. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me, as always, is the wonderful Sarah.
Hi.
Looking very good today. Love your
Thank
outfit.
you.
In the box, we got Travis. How are you, bud?
I'm good. How about yourself?
Doing great, man. It's a new year.
Yeah, new
Everybody
me.
have a good New Year's. I know you guys went out and did some stuff. Was it good?
Mhm.
Yeah.
Everybody was
Great.
safe. So
Yeah,
it
everybody
a good
was
year.
safe. That's important. So,
Yes, indeed.
I was going to ask, do you guys have any New Year's resolutions for 2024? Anyone?
No, I don't really make resolutions. Like I have like focuses or like mantras for the year.
Okay.
But not really like
Do you have
resolutions.
anything new for the year? Anything good?
The radio thing is starting to like kind of bubble a little bit more.
Is
so
it?
that's good. Yeah.
Yeah, that's
Yeah.
awesome, man. I know you have your own show. Tell me, what's the name of your show again?
So DD in the Morning is the show that I'm a part of. It's a radio show in Dallas.
What station is that on?
It's K104. So 104.5.
And what time are you on?
I am on from 4 a.m. to 9 a.m.
Okay.
Yeah.
I'm ashamed to admit I haven't checked out your radio
It's okay.
show.
No,
I don't
it's
listen
okay.
to a ton of radio, but I'm definitely going to listen to it.
It's
and
okay.
I encourage everyone out there to listen to Travis.
Next
I
time-
understand that it's really good. People have told me that.
Next time you're in the operating room, just go ahead, just cut it on while you operate.
I may do that,
We'll get
actually.
you through.
Okay.
Good idea.
So you guys, is it all talk or is it music talk?
So it's music and talk.
Music and talk.
It's music and talk.
K104, and it's Monday through Friday, 4 to 9.
Correct.
All right, I'm gonna check it out.
I got you. I'll
Cool.
shout you out.
Okay, man. I'll let you know. I'll shoot you a text and I'm
You're
listening.
gonna be like, he's
got
probably operating on somebody.
Yeah.
Right.
Yeah, I don't make resolutions either. I'm the only thing. This isn't a resolution, but like I really am gonna try and continue my exercise routine into the new year.
That's really good.
Yeah, it's been hard lately because it's been rainy and cold, and I'm an outside kind of runner, and so I haven't really done it the last week or so. But
Well, you know, I saw TikTok, and there was this guy talking about how the calendar, like our normal calendar, it was like invented like 500 years ago, and like the natural new year
Yes.
is supposed to be in the spring. And so when people
I think that would be awesome.
Yeah, so
personally.
when people make these New Year's resolutions, we're actually like supposed to be in our
in springtime.
when you think of New Year's resolution, you think of like big and bright and like new
Yeah.
you, but really it's like it's disgusting outside.
I know.
It's like the environment doesn't
Yeah.
equal the thing. So I was like, he's like, so if you want to continue to hibernate with me until spring to start your New Year's resolution, then
I'm gonna try and keep it up. Like
Yeah.
I was doing really, really good up until I did the marathon race, and then like it's been cold and rainy. I've been slacking off, so I got to get back into it. Because if you
alright.
get out of it too far, like then it's like you're starting fresh.
Well, every month I tell myself I'm gonna eat better, but
I've been doing all right with that.
I eat okay.
Yeah, I eat
I eat
pretty
silly
well.
sometimes.
Yeah. So
What is silly eating though?
Like I'll just like go eat fast food, like literally.
Oh, fast food. I've been
sense.
so good lately about not eating fast food. I mean, I was a big thing for me when I was just not even in that recent past. Like before I started noticing my metabolism slowing down, I used to eat like hamburgers and tacos like every single day.
Taco Bueno is my weakness. I love Taco Bueno.
I used to run the drive-through at Taco Bueno.
Really?
Yep, in high school.
Don't tell me anything gross.
It was actually good. I still eat there.
Okay, cool. I love Taco Bueno.
All right, well, we'll check back in the spring and see how our resolutions are going. But
Okay.
all right, so first segment coming up today is about buttocks enhancements, and it's something that if you've ever watched the
Those
show,
pants.
those are kind of cool, right? I like that the fabric on that. So if you've watched the show before, you know I've been kind of down on at least certain types of buttocks enhancements. And the reason I'm bringing this topic up is because people do talk about this. It is something you see all the time on social media. And I actually had a friend ask me about this just a day or so ago about like what are the options. And so I was kind of going over. I was like, oh, well, we should do a segment on that. So
For sure.
So I guess if you're going to talk about buttocks enhancements, the first way to kind of break these down is surgery versus non-surgery. Which is a good way to break down anything when you're talking about aesthetics. And so there are a couple of surgical options out there. The first one would be buttocks implants. So just like breast implants, you know, you can get silicone implants for your butt.
Yeah.
And
that's different from a BBL.
Correct.
Yes.
Yeah, that's because that's the next one we're going to talk about is Brazilian butt lift. So the short answer on buttocks implants is don't do it. You know, these things have never been greatly popular because of the risks associated with them. You know, when you put an implant in the breast, for the most part, it goes very, very well. I mean, there's millions and millions of women out there who have breast implants, are totally happy with them. The difference in putting an implant in the buttocks area is all about the fact that you're sitting on this thing.
I know. That's like your butt sees a little bit more action.
You're right.
Than your chest.
That might be the quote of the day. So yeah, I mean, you're exactly right. You know, one of the things that can definitely make surgery have issues is one, the location. So the buttocks area is not necessarily considered as clean as the chest. Okay, that's one thing. Pressure, like sitting on your buttocks. You know, when you sit on incisions, it causes issues with them wanting to heal. Also, the buttocks muscle has the ability to push the implant out of position. So these things have never been popular. There are still surgeons out there doing them. I'm highly recommend people do not get buttocks implants. I just have seen too many bad things happen from them. I've never done them, but just have seen patients have had issues, things like infection, implant malposition where it gets out of the place where it's supposed to be and the butt looks terribly lumpy. Injuries to nerves. There's some big nerves that run through the buttocks, and so placing the implant can injure those and cause like serious issues, which is not necessarily a thing in the breast. And then finally, wounds, with it being a dirtier area, sometimes these wounds will break down, plus the pressure of sitting on them. So although buttocks implants are an option that still exists, I personally do not recommend that you do that.
So which one's better? BBL or
well, if I had to, if somebody put a gun to my head and said you're either getting buttocks implants or you're getting a Brazilian butt lift, I guess I would take the Brazilian butt lift.
Yeah, sounds like I would too.
Yeah, so that Brazilian butt lift is the next surgical option out there for buttocks enhancements. We've talked about this on the show a lot. Basically, that is a procedure where you harvest fat from one area of your body, and then under ideal circumstances, you process that and then place it into your buttocks to augment it and shape it. And so on the surface, like it seems like it's a pretty good procedure. And I've done a ton of fat grafting more for the chest, for either cancer or occasionally for aesthetics. But oddly enough, I'm not a big fan, to say the least, of Brazilian butt lifts. I do have some issues with the surgery. For one, it does carry a 1,000 times higher rate of mortality, which is death, than the average plastic surgery. That is due to the risk of that fat getting into your bloodstream because there are big blood vessels in the buttocks. And we've talked many times about patients that have died from BBLs. I mean, throughout the last year or so.
One of my friends recently was talking about, like, whenever she loses, a specific amount of weight, that she's going to do all these things. And she's like, I'm going to get a BBL. And I was like, do not do that.
Good, Sarah. I'm glad you're like on the train with me.
I was like, no.
I mean, and it's not just me. There's a lot of plastic surgeons out there who are not fans of Brazilian butt lifts. The mortality risk is one thing. I will say that right off the bat, they do tend to look good. And I do have a picture I took just to show people, even though I'm not a fan of these, I wanted people to realize what they can look like. So throw up that first picture, Travis. So this is from Dr. Olson. He's from the Advanced Plastic Surgery Institute in Arizona. I mean, honestly, I think that's a great result. Like, I like the appearance, the post-op appearance.
Yeah, it matches her thighs. Sometimes people get them too big, and their thighs don't match the size of their butt.
I think the surgeon did a very skilled job. I think that it looks great. My concern is that this is probably fairly recent after surgery. I mean, not like immediately, but, one of the issues I have outside of the mortality rate for these is the longer-term risks. With fat grafting, there is always going to be some absorption. And unfortunately, the best way to limit that is to process the fat, which is a kind of a problem with Brazilian butt lifts. Because then if you process the fat properly, you end up getting a fraction of what you started with. I think I read on there that this was 1,000 cc's per side. So, if the way that I process my fat, I do have like a centrifuge. I send it through to get like this pure fine fat for injection.
Where did they get the fat on this girl?
You can see it like in her hips, their flank areas.
Okay.
Yep, you can see it.
They just moved it.
Yeah, you suck it out and then ideally process and reposition. But in this case, they injected 1,000 per side, so that's 2,000 injected fat. If you were going to process the fat properly, you'd need like 6,000 cc's of fat to get that much like good fat. And so then it brings into the question, okay, was this properly processed? If it's not, then there's a much higher risk of absorption. You can also get scarring of the fat, and you can get these lumpy areas.
I feel like her butt looks cool, like it looks good, but I feel like she could have gotten the same results by going to the gym.
Maybe. We're going to talk about that because there is a treatment that is similar to working out. And so I want to pick your brain on that. I don't know.
Because that doesn't look abnormal.
Yeah, it just looks good.
It looks,
And I
looks
do
like
compliment that doctor on
a
those
good
results.
butt.
I don't know that doctor. I just Googled BBL befores and afters. He's the one that popped up, so I just credited him for his pictures. And I do think it's good work.
It looks good.
So, so anyway, Brazilian butt lift, I'm not a fan. I don't think it's crazy if you go and get one, but there's definitely some potential downsides to it. And the other thing I'll say about it is, although every year plastic surgeries seem to increase in numbers, we talked about this a month or two ago, Brazilian butt lifts stay static, which means that they're not really increasing in popularity. They're not going down, but in comparison to other surgeries, they're not increasing, which does say something about them to a certain degree. So those are the two surgical options. I definitely don't like implants, and BBLs I'm really not a big fan of, as you guys are aware. So let's go on to the non-surgical options for buttock enhancements. Oddly enough, I read that some people are doing facial fillers for buttocks enhancement, which to me blows my mind because, when you're injecting in the face, there's not a whole lot of volume, and facial fillers are expensive, and the idea that you're going to put enough of hyaluronic acid filler in your butt to make a difference just is crazy.
And then it goes away.
Yeah, and then it goes away in a year and a half. Yeah. So I just kind of completely skipped over that one because I just don't think that that's realistic. But
the cost benefit's not there at all.
It's not even close. But there is one here too that I learned a little bit about. And at first when I heard about it, I was like, geez, I just don't know how this would work out. But I'm a little bit more favorable to it now. And that's the use of Sculptra. Have you guys ever heard of Sculptra? Mm-hmm. You have? Okay. So Sculptra is poly-L-lactic acid, which is basically a product it's also used in suture. I use a suture called Vicryl, which is the same substance, which in suture it just kind of breaks down slowly. But when you make it into a liquid form, which is what Sculptra is, and you inject it, it causes collagen formation. Okay. And this has been around forever. I remember, in fact, when I was in plastic surgery training in like 2007, my attending got Sculptra injections in his face. And I was like, wow, yeah, I can definitely see the difference. Like, it kind of plumped up his cheeks, and I thought it looked fine. Sculptra is a little bit expensive, and we're going to talk about that. But apparently people are now using it for buttocks enhancements. Okay. And I was like, wow. I wonder how much you would have to use. I will say that the results look pretty nice. And I did have a picture. Travis, can you throw up this next one? This is from Skinly Aesthetics in New York City. They had a lot of information about using Sculptra to do buttocks injections, which was great information. I think the result looks nice. It's a nice appearance. I think that this has some advantages over like a BBL. The advantages being, one, it's not surgery. Two, I don't believe it carries that higher mortality risk that BBL is associated with. You don't have as much issues with potential scarring as fat grafting does, but there are some downsides to this. I do think the results look nice. I was actually pretty surprised when I saw this. Like, dang, actually that looks pretty good. So here's the downside. So one, it's not permanent. It's a temporary effect, but it does last 3 to 4 years. So that's not too bad, right? It's better than the fillers, which last a year and a half.
Save up for the next.
Right. So here's the problem. Sculptra is not cheap. The average cost of Sculptra is about $700 per vial.
So how much was her butt, you think?
Yeah. So that's where this gets crazy. this guy who, there wasn't a whole lot of people who were talking about it, but that Skinly Aesthetics did have quite a bit of information. They were saying that they use at least 10 vials, on average 20 and up to 40 vials of Sculptra. So 10 would be
per butt cheek or just
total.
Oh, okay.
Yeah,
I was like,
10
oh.
would be $7,000. Like 20, which is their average, is 14,000.
That's like the price of like
More.
a boob job.
More.
Like a good one.
Yeah, more. I mean, 10 would
Yeah.
be like the price of a breast hog. So like to me, although actually I kind of like the results and I like kind of how the how it's done, where it's not surgery and it doesn't have so many risks. The cost to me seems prohibitive. Now maybe in New York City people can toss down $20,000 every few years and be okay with it. I'm not sure that would be super successful around here. Although I actually am thinking about calling the Sculptra people and asking about it. You know, it is an off-label use. I will mention that.
So can you use it in your chest then too? If you can use it in your butt?
I would. Yeah, I mean, I assume you could. Yeah, I mean, that's a great question, sir. I never thought about that you could potentially use it to augment your breast. I mean, I'm gonna look that up. I mean, that's interesting. I will say that result, and granted, with all these befores and afters, you know, people put out like really
The best of the best.
the best of the best. And even when I was looking through them, I wanted to find one that
Looks sketchy.
No. I wanted to get one that actually looked. I know I don't want to misrepresent these. I want to show you
Yeah.
what is the
Best
potential best
possible. Yeah.
outcome. And so, you know, those do look nice. So Sculptra is an option if you have extremely deep pockets. It's kind of a newer thing. It is off-label, but those results look reasonable. Okay, so the last one is what's called M-Sculpt Neo. I think we've talked about this just briefly in some other segments.
I've never heard of it.
So M-Sculpt is a brand of machine that uses radio frequency to treat areas. And what it does is it does two things. It reduces fat and
Okay.
it increases muscle. And I've actually done one of these treatments. We had the people roll through and they were trying to sell me a machine, and so they brought it up and I did a treatment on my abs.
Yeah.
And man, it is like so what it does is it causes really, really strong muscle contraction.
Oh,
So it's
maybe
like
you
a
did
really,
talk about
really,
it.
really intense workout in like 20 minutes.
Okay.
And so you do need 4 to 6 treatments to see results with this, but they're claiming that with 4 treatments you can see up to about 25% increase in muscle mass,
Okay.
which that's pretty impressive. I mean, you know, and I think I did have a picture of this one as well. Travis, throw that up there. Yeah, and so I will say to me it looks more of an athletic look, and this is where I was going to kind of pick your brain because, you know, when people get BBLs, a lot of them want that kind of Kardashian look where the buttocks looks really round and maybe not cut. You know what I'm saying?
Yeah, whenever I think of her butt, I think I've seen other women besides celebrities have that style.
Yeah.
And the butt never matches the thighs. If in real life, if you had a butt that big,
Right, you'd have
your
really-
thighs
would
would
be muscular.
be
Yeah.
the
Yeah.
same, and so it just looks
Totally.
abnormal to me. But the one you showed before, with the Sculptra,
Yeah.
hers looked okay. Like hers looked like she just naturally
Proportional.
had a big
Yeah.
butt.
Right. Well, and it's just like everything. Like you could do, you know, a Brazilian butt lift and not go crazy
I know,
with
but
it.
I feel like the only people who get
They
Brazilian
go crazy
butt,
with it,
Yeah,
yeah.
they do go crazy.
Well, I just thought that there was a differentiation between, you know, if you went into something like M-Sculpt where it's going to reduce fat, you're going to get more of that like runner look where a runner has like, you know, a firm buttocks, but it's not necessarily round and shapely.
Yeah.
And I'd say that before and after shows that. I mean, you know, that her buttocks look good, but she looked like an athlete, not like Kardashian. And when I say Kardashian, I don't mean like huge.
I don't
but
think she looked like an athlete.
You don't think so?
No, she
Throw
just
it back
looks
up
like
there,
she
Charles.
was. She just looks like she was a skinny girl, like just
Travis.
yeah.
Can you throw up that last picture one last time? The
To
M-Sculpt
me,
one?
yeah, to me, she just looked like she was just a naturally thin girl that just
See,
doesn't have.
I thought she had some good muscle. Travis, you there?
I am.
Oh, sorry. I think I caught you in a bad moment. Hey, throw up that M-Sculpt one last time. That
the
one you
last
just showed.
picture, the last butt picture.
This one.
I don't know. See, to me, she has that really kind of muscular
If she
buttocks
was
look.
to
Or at least
me,
compared to like the one on the left.
to me, if she was an athlete, her butt would not look like that.
Yeah.
Her butt would be like a good sized butt. Like her butt would look better than the one on the right.
Yeah. Well, it is
To
only
me.
4 treatments. I mean,
I think she's just a naturally thin
Yeah.
girl.
I do think it looks better than the starting point.
It does.
Yeah.
It could be her panties though.
It could be. It's all,
I don't know.
It's all about the accents,
if they
right?
were the same,
Yeah.
if they were the same undies, I think it would be better.
Well-
but it does look different,
Yeah.
for sure.
But I would say that is the one
looks
differentiation with
lifted.
M-Sculpt, where, fat grafting or Sculptra tends to give that more kind of mix of muscle and adipose tissue. M-Sculpt gives you more of a muscular look because it does reduce fat. So
Yeah.
that's just something to be aware of.
Yeah, it definitely looks lifted.
And then finally, the last thing is working out.
Yes.
Working out can make your
Advocate.
buttocks look better. Yeah, it
I
doesn't.
wish I had a before and after picture of my friend, who was a naturally skinny girl, like just super skinny, slender
Mm-hmm.
chick. And even when she was in gymnastics with me in high school, like never had like the same amount of muscle proportion that I had.
Uh-huh.
And whenever she started doing Olympic weightlifting, just using weights,
Right.
not running, not doing anything like that, just strength training, her butt and her thighs got significantly bigger.
Yeah.
I wish I had before and after. I'm sure she does, but I
Right.
don't have one.
Yeah.
But her butt and her
Yeah.
thighs looked so
Of course,
much better.
it's just hard. I mean, that
Yeah.
amount of dedication to get something
Oh,
like that.
it took her like a
yeah,
year.
It takes time. Yeah,
But-
a lot of people just can't do it. Yeah.
Yeah, but I mean,
But if you can, that's I'm
there's
always
other
a
benefits besides having a good butt.
for sure. And I'm always a fan of like if you can get something on your own and avoid surgery or treatment. I mean,
Yeah,
it's
you
obviously
can't
the
really
best
get
way.
bigger boobies on your own, though.
That is hard to do.
Yeah.
It's hard to do. So, all right, I just want to recap this segment really quickly. So today we were talking about the different options for buttocks enhancements. There are a couple surgeries out there, actual buttocks implants similar to breast implants, which I'm not a big fan of due to the complication potential for that. There's Brazilian butt lift, which is injecting your own fat into your buttocks. I'm one of the people who's also against Brazilian butt lifts. It does carry a much higher mortality rate or death rate in surgery than other plastic surgery, and there are some long-term issues, but I will say they do look nice right off the bat. Some of the non-surgical options, Sculptra, which is an injectable for the buttocks, is kind of new. Some of the results look pretty nice, but the cost can be prohibitive. It sounds like you're looking at a minimum of $7,000 up to like $20,000, and it only lasts about 3 or 4 years. M-Sculpt Neo is a radiofrequency treatment which decreases fat and increases muscle to give a more muscular look to the buttocks. Not a bad treatment. Of all of them, I would maybe consider that one to be one of the better ones, but those are the options out there, and so now you know. If you have any questions, please leave us a comment. So, all right, buttocks enhancements. I think we rounded that one out. We rounded that one out.
No pun intended.
No pun intended. Okay, all right. So we haven't had like a crazy plastic surgery story
I know.
in a while. Like it's been kind of a lull.
I'm gonna already guess where it comes from.
You are you gonna guess? All right. So this is actually a story about a plastic surgeon who was accused of operating while intoxicated. Which sounds
Danger.
yeah, that does sound dangerous. And so I want to talk about this story, and then talk just a bit about what's called impaired physicians. Have you ever heard of that term called impaired physicians? Yeah. So that's a term in healthcare and I'll explain what it means, but it's just basically a physician that can't do their job for various reasons.
Right.
So this story is out of.
Florida.
No, it's not. It's
Dang
Arizona.
it.
Sorry, I set you up. You're normally right. So this actually is out of Arizona. And I'm going to lead off with, I don't believe this story.
Okay.
I'm all for holding doctors accountable, and there are bad doctors, bad surgeons out there. We've talked about a lot of them. There's some things about this story that to me just don't add up. But I thought we would kind of discuss it. So this patient had a tummy tuck and breast reduction by a doctor out in Arizona, and this guy's a legit doctor. He's board certified plastic surgeon. He's got
Okay.
years of experience, so he's not like some fly by night guy. Good reviews. I mean, I always look these people up to see is there some warning sign. No, this guy seems like really good.
Yeah.
You know.
He's got all the things.
He's got all the things, checks
Okay.
all the boxes. So the patient was set up to have a breast reduction and tummy tuck, and had the surgery, and apparently had some complications, which it's not super specific, but to me sound like potential legit complications that can happen.
Okay.
Tummy tucks and breast reductions are some surgeries that do carry risks. We've talked
Right.
about that before. So, surgeon very unhappy. The patient was very unhappy. So the surgeon, I keep saying surgeon, the patient ends up filing a lawsuit. And so in the lawsuit, the patient claims that when the surgeon came in to mark her, that he reeked of alcohol. So I was like, well, that's unusual because, I mean, if you were going to go and have surgery and you legitimately thought your doctor was intoxicated, well, would you go through with the surgery if it wasn't like life
not
or
at
death?
all.
I mean, there's no way, right? No
Right.
I would have like grabbed the nurse and been
Right?
like,
No, there's no way that anyone would do
"Do
this.
you smell something?"
Right,
funny in
exactly.
this
And or like,
dude?"
it'd be the same thing if I got on an airplane and like the pilot was like, "Mrrr," and had like a drink in his hand. I'm running
Y'all ready
out
to
the
party?
I'm running out the door, man. Like the fact that this patient claimed that she smelled that reeked, it said in quotes, reeked of alcohol, but then said, well, I was already there, so I just thought I would go through with it. I'm just like, yeah, I just don't believe that. Also, too, and this is a little bit of detective work. So this surgery is pretty much an all-day surgery, which means this surgery was started at 7 a.m., okay?
So this doctor would have been out.
What, like
on the
coming in
town.
straight from the
Yeah.
bar, or like what, drinking in the morning? Like, I mean, I could believe it maybe if somebody said, hey, you know, I went and had plastic surgery and I had a complication and I called the doctor and he met me at the office at 10 o'clock on a Saturday night and he smelled of alcohol. I'd be like, oh, I can maybe see that happening.
Yeah,
But-
or if like a doctor like went to eat like lunch with his friends.
Okay, sure.
Happy
yeah.
hour. or
Right after
something.
surgery,
Yeah.
patient, you know, yeah, I could maybe see that. But 7 o'clock in the morning, I mean, how hardcore of an alcoholic do you have to be to like reek
A
of
really
alcohol?
functioning one.
Right, exactly, right. So that kind of to me was a little bit unusual. Also, the fact that it was at a surgery center. I looked this up. So there was at like a surgery center, and we've talked about how you do have more protections at a surgery center because
Yeah.
there's so much oversight. And so I don't know. If it was at like a private office where the doctor has like dictatorship control, I could.
Yeah. Well, so like he was around many other medical professionals.
Right. Yes.
And there would be no way that another medical professional would have been like, "Hey, you smell like alcohol, but that's fine."
Yeah, I agree with that. I mean, and so like the story to me just it didn't add up. So anyway, so there's a lawsuit over this about her complication, and then the odd thing is that she said she had corrective surgery that cost $25,000. Like that's insane. The original cost for surgery was $16,000, which to me is high. Like if I do tummy tuck breast reduction all the time, and it don't
Yeah.
cost $16,000. But a lot of that is depending on where you're at. Like plastic surgery cost is relative to location, and so I mean I live in a nice suburb, of Dallas, but it's not the fanciest suburb in Dallas. So our prices are actually a lot cheaper than in some of the other Dallas suburbs,
Right.
just because of cost of doing business. So $16,000 for a first surgery to me is high, but not like crazy. But $25,000 for corrective, like I was just curious, like what did she have done to cost $25,000? So this girl ends up joining a Facebook group for tummy tuck complications and posting her picture. And apparently someone messaged her who had the same surgeon, and so that person filed a lawsuit as well and claimed the same thing. So now you have two patients claiming that this doctor smelled of alcohol, but then they went through with the surgeries. And I'm just like, I don't know. I mean, that does happen. We saw that happen to, remember Dr. Roxy, the girl that was the TikTok doc?
Yeah.
But you remember when she had that first complication and then it kind of went public and then people started coming out of the woodwork.
Yep.
And some of them, the complications were like, well, is that really like a malfeasance issue or is that just a complication?
Yeah.
And I kind of think that's what happened to this guy that,
This is aftershave.
yeah, I don't know, maybe it is. But yeah, I don't know. I mean, like I said, this is all being reported in the news. I did check it, and he has no board complaints against him. So I don't know. To me, the story is not believable, and I will believe almost anything these days. And that's just my opinion. I only know what I've read about, like in these news. I looked up, several newspaper articles, and you can look it up. It's just fresh from this last week.
To me, it sounds like a lawyer just popped that into their brain. Like, did you smell anything funny on him? And like the patient was like, you know what? He did smell different.
Yeah, exactly. I kind
they
of agree with you,
twisted
Sarah.
it.
I kind of feel like that this is something related more to the lawsuit. If there were other like warning signs, like board disciplinary actions or DUIs or something like that.
Yeah, missing appointments.
Yeah, I mean, you could potentially make that argument, but
just erratic behavior.
yeah, but you don't see it with this particular
Yeah.
physician. So I did want to talk a little bit about impaired physicians. Impaired physicians is defined as the inability to practice medicine with reasonable safety and skill because of a physical issue, psychiatric issue, aging issue or
Yep.
dependency issue.
Yeah.
So Impaired Physicians does cover a pretty broad, topics. We did a segment on how old should a doctor be before they retire.
Yeah,
And we
I
talked-
remember we watched like a TikTok with an older doctor about
right,
something.
yeah, I did. Have we done so many shows? I just didn't start to run together. But yeah, it was about like the age, right?
Yeah.
It was about, are they too old to do their job?
Mm-hmm.
So that'd be considered impaired. Psychiatric issues, if somebody has like really, because doctors are people too. They
Yeah.
have the same issues that people. And then of course there are dependency issues. And so I was going to talk a little bit about dependency issues with physicians. So dependency issues, whether it be alcohol or drugs in physician population, mirrors the general population. So physicians are no better or worse or more or less likely to have addiction issues than regular people.
Yeah.
So that comes out to about a 10% lifetime risk. So 1 in 10 doctors sometime in their lifetime, not their entire lifetime, but sometime in their lifetime will have an issue with alcohol or drugs. And I've actually seen this myself. I've had friends and colleagues that had to go to rehab for various things, whether it be drugs or
Yeah.
alcohol, and you do see that.
Sometimes I would think it's like they're almost more, they have it available more around them
Yeah.
just because of like they have an increased
Stress,
stress, and
Yeah.
then you also
accessibility.
make pretty good money.
Right,
So it's
you have
like,
money. Yeah. I think that there are two things. One thing that makes it more likely and one thing that makes it less likely. You hit the nail on the head as far as, what things makes things more likely. Stress. People are stressed out. They look for an escape. Accessibility. Historically in medicine, you hear about anesthesiologists using narcotic drugs. Now,
Yeah.
I don't want to paint my anesthesia group friends with some brush, although I'll give you some stats in a minute. But you hear about things like that. And then, so there's the stress and the accessibility, right? So you think, okay, maybe doctors have a higher rate of this. But then on the other hand, why they would have a lower is the repercussions. Like if you get hit with like a DUI or, you show up to work drunk, you're potentially losing enormous amounts of income.
yeah.
And so I think that keeps a lot of doctors on the straight and narrow. I'll tell you my own personal thing. When me and my wife go somewhere like out, we do not drive.
Right.
Period. We do not drive. We Uber everywhere. If we're gonna have any drinks at all, so
Yeah.
like if we're going out with our family, obviously we drive. But like if we're going out to for the night on the town or going to our wine club, even if we're going a mile.
Yeah,
we
there's
Uber.
really no excuse.
There's no excuse, right?
Yeah.
Because if you get hit for a DUI, it can ruin your career. And so
It can ruin anybody's career.
true, but like there are a lot of people though. That's 100%
Yeah.
true. But like if you get hit with a DUI, like automatically your career's not over, but you're gonna have like a huge break in your practice
And the
because you're gonna
ability
be
to get hired too if you work
right. Exactly.
somewhere for somebody
So I
else.
think that keeps some doctors on the straight and narrow.
Yeah.
As far as doctors are most at risk, anesthesiologists are one of the doctors most at risk for this, as are ER docs.
I would think because of trauma.
Yeah, they
The
say it's
stress
that
trauma thing.
they say that ER doctors tend to have a higher risk-taking behavior, just because it's something that
They
attracts
like
them.
it.
Yeah. Prescription drugs are more commonly abused by physicians than other groups, and that's because of knowledge and accessibility for sure.
Yeah.
They are most commonly found out or reported by hospital staff, and we were talking about
Yeah.
that in relation to that story that there was like a whole surgery
Yeah.
center full of people that could have pointed that
Well,
out.
you've said like if you see something, say something.
Yeah.
Well, that's really big in
Yes.
your
And
medical
that is
center,
kind of
so-
a problem because historically doctors have protected each other. I've heard that happening where everyone knows Dr. So-and-so does something, but whether it be impaired or a bad behavior, but there's like this kind of protection. I think that's getting less and less these days. The days of doctors getting away with stuff is kind of
Yeah.
going away. Yeah. But one thing I'd say, just kind of in summary on this is, if you have concerns with your doctor, don't continue to have a doctor-patient relationship.
Yeah.
You have to trust your doctor. And in this story, to me, it seems like maybe it's not true, definitely if you have a concern, don't go through with the procedure. Feel comfortable with your doctor, feel like you have a honest, mutual, good relationship, and you're just much more likely to end up having, good outcomes.
Yeah.
So
I agree.
that's that. But yeah, that story's a little unbelievable to me.
Yeah, I would say.
So, all right, Sarah, you're going to educate us.
Yeah,
I need
get
to
my
know these things.
notes.
I do want to get back into a workout phase, and so I need to know this about how to maximize my workouts. So is there a supplement that might help me?
Yeah, so it was actually because I watched a TikTok.
Dude, I get so much stuff from TikTok.
And this guy was talking about an article he found about magnesium chloride supplement.
No, that's just standard magnesium, right? That's not like a special formulation of magnesium.
Well, I guess.
Okay.
It's magnesium chloride. So
Okay,
I
so
guess
that's like the
magnesium is different than magnesium chloride.
Well, and I think
magnesium chloride's the only supplement for it.
right. A lot of the supplements have to be tied. So it's like
Yeah.
salt is not really sodium. It's sodium chloride, right? So
Yeah.
I just want to make sure it wasn't like a special magnesium. So it's
No,
just
you
standard
can go.
magnesium. Okay. All right.
Yeah, you can go to the CVS and get it
Okay. All right.
for sure.
Sorry, didn't mean to derail you.
I have a little picture. I don't know if Travis has it, but
He did. If you send me, yeah.
oh yeah. So that's
the
the
article.
article I read, but that's not the same article Dude Bro was talking about. In the
You found a
TikTok.
better one. Because
I
you're a
don't know if
detective.
I found a better one, but I found one. It was hard for me to find one, honestly, because there's really not that many studies about it.
Okay. All right, so
this one's
educate
from,
us.
This one's from actually 2017, so it's really not that new, but
All right. Educate
we'll
me.
see. Okay, so what is magnesium chloride? Magnesium is a vital mineral in the human body,
Yes.
acting as a cofactor for enzymatic reactions involved in energy metabolism, cell growth, glycolysis, and protein
Yes.
synthesis.
I knew some of that from med school.
So to me, it means that it just helps you move
Have energy,
Yeah, it
right?
just helps. It literally helps in all things working out. To
Okay.
me, that's what it sounds like.
Yeah, I would agree with that.
And you need it to work out
I would agree with that.
and to grow muscles and stuff. So the relationship to magnesium and exercise, magnesium distribution and utilization are influenced by exercise, with magnesium playing a key role in both strength activities and cardiorespiratory functions. So, again, magnesium,
Right.
big role in exercise.
Got it.
So, sorry if this is boring, but
No, I mean
it's
this.
very.
You
The
have to lay.
article was also.
You got to lay the groundwork for what does this do and how is it going to help me. So
Yeah.
I did the article. Did the article look at different groups taking magnesium or not magnesium and see how their exercise played out?
I think I get into that. It talks about strength training.
Okay.
Specific. It just talks about human exercise performance. It does talk about animals, but I didn't really feel like I was like, we're not
Right. If there's human
We're not
studies, those are always
rats.
better.
Yeah.
Yeah.
we're
It's always
humans.
better.
Yeah.
So what was the lowdown?
So, well, first let's talk about what you can besides if you don't want to take dietary supplements. Like where is magnesium
Okay.
found?
Yeah, that's great.
Naturally.
Is it meat products like?
No, it's nuts, seeds, fruits, vegetables, and whole grains. That is where you find most of your magnesium.
I eat a lot of nuts, so I probably have good magnesium levels.
Yeah, you might. And so the recommended amount that you need to take is 400 to 420 milligrams for males, and then 310 to 320 for females above 19.
Okay.
So
And that
I don't even know.
Is that a lot?
I don't know. I don't even know what that would look like.
Yeah, I can look that up. I personally don't know off the top of my head. I mean, I can tell you that in the United States, when it comes to things like magnesium or other factors that are used for metabolism, vitamins and whatnot, that our diet in the United States is really diverse and really good. So it's pretty rare that somebody gets a deficiency of vitamins or cofactors like magnesium.
Mm-hmm.
But that doesn't hold true if people adhere to different diets. So like
Right.
vegans are like the first thing that pops in your head.
It seems like they would have more because it's mostly
Yeah.
found in nuts and seeds and stuff.
Right, but I'm just saying
Yeah.
it's and I just threw vegans
Sometimes.
out there as like somebody who follows like a weird diet. Okay, so someone who only does keto, right?
Yeah.
Maybe they just eat meat, right?
Yeah.
But not nuts. So
Which is that's crazy.
so in general, our levels of these are pretty good. But I guess the question I would have, and maybe I don't know if you,
yeah, I think I know what you're getting at. Do athletes need more?
right
People
is
who exercise.
well, do people who exercise need more,
Mm-hmm.
and is there a benefit to taking more than the daily recommended allowance if you are exercising?
Right. Yeah, they'll talk about it.
Okay.
So the key thing is, despite its critical role,
Yeah.
physically active individuals, especially in accelerated metabolic situations, so people that do a lot of exercise.
Okay.
So somebody like me, I guess, I work out.
Hardcore workout people.
I work out a lot. I may need higher magnesium to
offset the
get to my
losses.
goals.
Yeah.
Get to my goals
Okay.
and working out. So the study talks about this. The human studies associate serum/plasma magnesium levels or
Yeah.
magnesium supplementation with various exercise outcomes. So the exercises they looked at were bench press, hand grip,
Okay.
trunk flexion, heart rate, and energy needs.
So it's probably just like a spectrum of
Different
things.
types
Okay.
of things.
So-
To make it random. So
Okay.
they did find that in this randomized controlled trial with the magnesium supplementation showed improved exercise performance
Oh, really?
in
Okay.
a 20-meter shuttle run test by reducing lactic accumulation. So that means
Right.
it decreased like cramps and then like I guess the after effect of your muscles getting too sore.
Right. And that makes sense if, and I'd have to really kind of dig back in my physiology databanks here.
My brain was over.
You're like,
When I was reading this,
smoke
I was
coming
like,
out of your ears.
I haven't read a medical
Right.
article in so long.
What I would tell you, at least it comes to my mind, is that for something like lactic acid buildup, if the rate limiting step to that is not oxygen, because normally when you get lactic acid or cramps, it's due to the fact that you're overexerting your body's ability to deliver oxygen, and so you start to go into anaerobic metabolism. So instead of like using oxygen to make energy, you're doing it anaerobically, and one of the byproducts of that is lactic acid, which
Yeah.
is what builds up in your muscles and gives you cramps, right?
Yes.
So if having extra magnesium allows you to continue the aerobic cycle where you're burning oxygen and not making lactic acid, then I could totally see how that would allow you to exercise more.
Yeah.
I don't know if that's true. I may be just making that up about the magnesium, but it sounds like that it does.
Yeah, I feel
to a
like
certain degree.
magnesium like acts as like, the taxi driver of oxygen, or something. Like, is
Yeah,
that,
I don't remember
Like,
it-
it's like the more magnesium you have, the more the ability to process
I'm probably gonna get
all of
skewered by
that.
my wife because I don't remember this, and I bet she doesn't remember any of it. But like I remember we started to make these drawings of how how you create energy, and I'm pretty sure magnesium's in there somewhere.
Oh, for sure.
Like,
Yeah, it's
making
in
it
that
pass in
process.
like the aerobic side, the Krebs cycle, I think is the name of it.
Yeah.
So yeah, I guess, and so having extra supplements showed they were able to work longer.
With that shuttle run.
Which,
Some-
well,
yeah,
I mean,
so,
and
yeah.
that's a good representation.
So, like most medical studies, they have to talk about the fails, the
Okay.
parts that didn't work. So,
Okay.
it says, while some of the studies suggest benefits, others fail to observe any positive effects.
Okay.
So,
Is it just running? Maybe not weightlifting? It's
maybe. But to me, after reading that, I found that it doesn't, taking the supplements, it's not going to hurt you.
right. Yeah, you can't. like,
Obviously, you
get too
can't take, you can get magnesium toxicity.
much. You can get toxicity of anything. You
Yeah,
probably have to eat,
I
like,
thought
the
that
whole-
was different. I
the-
thought that
the
was
whole-
different than noticing that it was just different. Seeing like you can take too much of a supplement because I think most people don't realize that.
Yeah, I mean, a lot of people think supplements are very safe, but there are toxic doses of them.
Yeah.
Usually they're pretty high.
Yes.
Yeah.
So for me, after reading this, I think I would take magnesium chloride if I was hitting a plateau in my exercising.
And see if you can get over
to
a
see
peak.
if I
Yeah.
could get to, like say I wanted to deadlift, 250 pounds
Mm-hmm.
and I'm at 225 and I just can't get past that.
You might try it.
Yeah,
to see if
I
you can
might
get
try
over
it to see if I could, if it would allow me to work out more.
And magnesium is probably pretty cheap, right? I mean, that's not expensive.
sure.
Yeah, that's
Yeah, you can get it. It's
like-
tablet form.
yeah.
But yeah, so
So
Bottom
so,
line,
So
bottom
bottom
line.
line, there is a study out there that shows
Yeah.
that at least for certain exercises,
Mm-hmm.
taking magnesium supplements allows you to overperform.
yes.
Interesting.
It allows athletes to get
And that's
some better
actually pretty
performance.
notable because there's a lot of studies out there for different supplements that show that doesn't really make a whole lot of difference. So if you have one study out there, of course these studies always bring up more questions like, okay, well, how does it do that, and like why doesn't it do it for other things? But But you do have a study that's out there that's a legit study that shows
this article definitely was like there needs to be more studies for
Right.
us
They
to like
always
say
say that.
100%.
Yeah.
They always say that.
But it's good to know. I mean,
Yeah.
I didn't know that. I mean, when you brought up this topic, I was like, oh wow, I've never even thought about that.
I didn't
And
think of it either until I saw that dude talking
TikTok.
about it. Yeah.
Excellent.
TikToks.
Well,
always,
thank you, Sarah. I always
Yeah.
appreciate you weighing in. And you're kind of like my idol as far as working out. I know you work out really hard, and so I need to get back to that.
I haven't
so
worked
I take
out.
your advice seriously.
Okay.
I do. No, really. I do.
Well,
honestly.
I haven't worked out in 3 weeks because I had the flu.
Yeah, on Christmas and New Year's.
And
all
then
that,
Christmas, and then I was just like,
get it.
yesterday was the first day back.
Really?
Mm-hmm.
So you're sore today?
Honestly, not that much because I took it easy because I knew
yeah.
I was like, I got to start slow so I
Right.
don't
Yeah.
burn myself out.
Right. You don't want to go too hard.
Yeah.
All right. Well, thank you again. I
sure.
think that's all the time we have for today's episode of Nip Talk. Please join us next week. We'll go over some more topics. If you want us to do a certain topic, just leave us a comment wherever you see this on YouTube, Instagram, or wherever, and we'll talk about it because we want to tell you what you want to hear. So, all right. Have a good week, and we'll see you next time.
Yeah.